So I'm David Silva. My practice is a very new practice. I formed 3 months ago. I had been working with Fairfield Equine for 10 years and then I decided to go solo and do just the sports medicine and rehabilitation type. We start trying the Hilltop products while with Fairfield, mainly for lesions in tendons and ligaments. Probably around 3 years ago when we start using it in combination with stem cells or by its own, but that's when probably we start using it. The results have been very good, very happy with it. That's why we keep using it and are using it more and more. Many different applications, different cases, but so far has been above or comparing to any other product, including orthobiologics or on any other amnion derivative type of product. So for me it's very practical, it's very easy because the product is right there available. I just need to mix it with a little bit of saline and treat the horse. In ambulatory practice there is also sometimes when you have a horse that has just came out of a show, or that orthobiologics will not be ideal because of the horse condition or stress or prior injections or close to show time per se. It fits perfectly. It's very easy, fast to use the product, and it's readily available. Yeah, there was a couple cases. One, and that's when I started and I used the Stridaflex, was on a case that I did not trust the orthobiologic. It was a metabolic horse, older horse. I did not want to use a orthobiologic because there was, even if the SAA was 0, there was still some questionable general type of abnormalities in the blood, including may even have some sort of infection, so I would not feel comfortable to use the orthobiologics. And definitely there was osteoarthritis in the joint, there was change in the joints, and I did use the Stridaflex with quite success, and that's when I started using it for the limitation of I have used it other times as well, due to when you have some close to competition, and you know, everything is so close together that you have just to move fast, and also with good results. So I had very good results, mainly in combination with stem cells, with allogenic stem cells mixed together. I had one suspensory branch that was basically a known healer. It wouldn't go away. We consider splitting the ligament. We considered the other type of treatments after having addressed it with PRP, which was quite unresponsive to that. And then we did a combination of stem cell. So I basically used it in combination with a stem cell and the Regeneraflex, and that was when it really turned the corner. So we didn't end up doing any type of surgery or anything. And that was within a week that we saw a difference. That was very positive result of using the product. Yeah, I feel that the Hilltop products compared to any other amnion product, it's obviously because of the different cases, it's always very hard to assess if one did more than the other, but for sure I did not have any sort of less result with Hilltop, by the contrary. With the orthobiologics, I think it's very lesion and case dependent. There are still cases that I would still probably prefer to go with a PRP orthobiologic type of product, but definitely there is a very good place, and the result I do feel that compares to quite an extent to the orthobiologics, and obviously it depends on the case and the type of injury we have, but I feel very comfortable using it. I never had a flare. I did have a minor enlargement of the injection site when I do a soft tissue, but that is super expectable. I did not have a leg that blow up as a flare or that cause discomfort to a horse in a joint. And the horse, the one I was just telling about, the case I used, the Styroflex, the Stridoflex on joint, was a metabolic horse, so it was a horse that I was a little bit apprehensive about having a flare. I still trust the product, and I did not have any downside on using it. I think the website is very informative. I think there is enough testimonials and enough information there that will give comfort, that will show people that it has been widely used and with good results, and I feel that will probably encourage them to understand where to use it, when to use it, how to use it. That's very important, so the amounts are the correct amounts and not have a downside or a negative effect because of not correct usage. But I feel that the website and obviously all your vet support team that you have will be very assuring that you will have a good result with the product. Yeah, well, that is very straightforward. I don't think that there is not really an issue. The product is available. I do keep it in stock. To me, it's easier than to try to wait for delivery, because there is a lot of these deliveries that's external to companies, to anything. So I do keep it some in stock. The pricing, I think it's of a good price point. Availability has been always available whenever I asked for it, and the quality, I think it's proven to be controlled and to be of high quality. So happy.